Let's bring in Dr. David Putrino, okay? Long COVID specialist. He is part of an emerging trend in medicine. People who have to commit to this because it's so engrossing. He's at Mount Sinai Health System in New York, and Cornell University virologist and research scientist, Dr. John Moore. John, it's good to meet you in person. Thank you for helping my own personal education and understanding what matters and what doesn't. It's good to have you here. And Putrino, thank you very much. I'll start with you. Putrino, how much does this report echo your reality? And what do you want people at home to know about how significant this is?
Yeah, absolutely. Thanks for having me, Chris. It's a great report that goes into comprehensive detail about the seriousness of long COVID. This is something that we've been seeing in our clinic as we've treated over 3,000 people with long COVID over the last 4 years. And what we see is an illness that destroys lives. We see people who were fully functioning in their former life completely taken out, unable to work, unable to provide for their family, unable to be a friend or a family member like the way that they used to. And we really don't have much in the way of treatments. We can manage symptoms and we can provide strategies to help people maybe get a little bit of function back, but we have no actionable treatments right now. And frankly, this report, while great, should have been released years ago because we knew all of this information, in 2021, 2022.
Now, a lot of people are blowing up my phone right now, John, and they're listening to Putrino and they're saying, no. There's no long COVID. There's only long vax. This is all the vaccine that's doing this, spike protein from the vaccine. What do we understand about the vaccine at this point? And what does it mean in terms of what long COVID is and isn't to you, Mr. Moore?
Well, the simple fact is, as the report does detail, although not in great length, that vaccinated people, when they get infected, are less likely to develop long COVID and their symptoms are milder. So the COVID vaccines actually protect against the worst aspects of long COVID, at least in a significant number of people. It's not absolute protection, but the statistical significance is clearly there. So vaccination is beneficial. And long vax is just another of those myths that all too many people believe in. There is no such thing as long vax.
Dr.
Your
Putrino,
own symptoms.
Go ahead, John.
Your own symptoms started in 2020, as I understand it, Chris. That was a year before the vaccines became available. Now, what does that say?
Yeah, listen, I mean, more than one true thing can be true at a time, right? Again, it's just a matter of fact, Dr. Putrino, just to bring you up to speed on me, I have long COVID. I had my symptoms. They never went away from having COVID. They were just like little dips, ebb and trough of ever since. And then I got vaccinated. I don't know if that could have exacerbated it. What are you seeing in your practice in terms of people who are vaccinated? Does that help or hurt?
Yeah, I would say that we want to follow the data here, and I think one of the best sources of the data was from Ziad Al-Ali, who was one of the authors of this paper for the National Academy of Science, showing that, as Dr. Moore mentioned, vaccination does reduce the severity of your acute SARS-CoV-2 infection and therefore leads to a reduced risk of long COVID. However, my colleagues, Akiko Iwasaki and Harlan Grumholz, have joined me in writing a piece about vaccine injury, which was recently published in the American Journal of Science, showing that it is, in fact, a phenomenon that we need to be studying. Side effects do happen from things like vaccination, and we cannot completely dismiss the lived experience of thousands of people who are saying that they started to develop symptoms after vaccination. So this is something that we are actively engaging in research with right now. We still maintain that infection prevention through vaccines is a good thing. We still maintain that vaccinations net save lives, but we should not forget that people are having adverse effects and we should be studying it.
Hey, thank you for watching. Please go to newsnationnow.com, newsnationnow.com, and you can find NewsNation on your television provider. And don't forget to click the red subscribe button down below. Then you will get more of NewsNation's fact-driven coverage.